So first, I just want to mention that, it's not just me. There is a team behind this. We've had wonderful contributions from Dr. Sereni, who's an AIRC research scientist. Ethan Silverstein is a grad student, and he'll be graduating this term. And then I've also had some great inputs from my co-PI, Zoe, and don't ask me to pronounce her last name, Zushin Farber. But just to kind of level set everybody, Lynn did a great job kind of, explaining part of the problem is, once you have a problem identified in the policy arena, it takes quite a while for us to go through all the hoops, if you will, to consider a solution, to actually, put the statute in place, get it into an NDAA, negotiate it back and forth between the different stakeholders in Congress, and then the statute to reinforce the solution, and then for the DoD to actually implement a solution. And then to sit around and twiddle your thumbs and wait to see whether or not that, solution that you implemented actually works. And so this takes a long period of time, and not all agencies are the same. I mean, we have, for example, the National Institutes of Health does lots of great policy examples. And I will specifically talk to one of those here in a second, as soon as I can change the slides. If you're at home, if you want to just do a quick screen grab of this slide, because I'll be talking to it probably quite a bit. But putting the policy test lab in the middle and thinking about it from that perspective, this is kind of what my operational view looks like, ROV1 from DoD, DODAF vernacular. So basically, I have some policy owners with a question, right? And that can take different forms. It could be just a quick email, hey, I've got a question on this kind of a policy, or it could be, here's the new statute. Can we go off and model this before we actually try to go towards an implementation? So I've got the inputs on the left-hand side here. So I've got, I have to go look off at different official policy parameters, whatever those may be, existing operational data. And then when you get to agent-based models, we definitely want to have behavioral and population data information, economic information. Then I've always got, different kinds of constraints, privacy issues, and things of that nature. So these are what would get fed into a policy test lab, right? And down at the base on the bottom, if you want to think, and we're going to do bottoms up, now what I can do is I can do what if exploration, doing different types of models. I can play with different policy levers. I can do uncertainty analysis, doing just different statistics analysis types approaches, trade-off analysis. So there's a lot I can do on that side. And then I'd kind of feed that, once I was all done with all that, over to the decision makers. And you can kind of think of this as communicating on both sides. It wouldn't just be a one-way arrow. But once the committees and stakeholders have had a chance to take a look at, what the analysis showed, you can think of then the statute and the legal changes, for example, for acquisition reform, the BFR, DFARS change. And then for the policy test lab, the best thing to do is now have in that DFARS change what data, that I could then go mine to see how that policy is actually going forth and whether or not my model was well calibrated. And so now to just kind of go through a demo of what we currently have implemented, I'm just going to walk you through this. I'll play it. So when I mentioned the National Institutes of Health, I've been doing modeling this stuff for quite some time. And so one of the things I knew is that there's actually been a lot of investigations on, believe it or not, chocolate milk as a school staple item for lunches and even potentially breakfasts in some cases. So now the question is, okay, what if I did what I call an antithesis model policy where I'm telling my chat agent here, I want to actually have all kids drink chocolate milk. And so, being a mom or a dad, you say, well, what about the health impacts, right? What about childhood obesity and things like that? So what you're seeing me here is literally just typing in the policy question. And now I'm going to hit enter. It's now going off to ChatGPT, the large language model, to start thinking about what I call a scenario. And that scenario will identify all the risks. It will identify the different agents, like the child, the teacher, um, and school officials, your doctors, and what have you, right? So that all comes back here. Now I'm going to do is I'm going to send it out for research. And now it's going off. It's thinking and looking for papers applicable to my policy question. And it can go through and it'll find some decent papers. And now when we built this, we can actually go off and say, okay, let me send all these off to my paper search. I can also, if I've done this a few times, or maybe even I just went off and searched really quickly on ChatGPT or even Google and found some papers, I can literally just drag and drop them in here. And now what will happen is the models will be analyzed, or the papers will be analyzed for models. And here you see an example of it found a systems dynamics model in this one paper. And actually, if you go look at the paper very carefully, it doesn't have the model in it, but it discusses the model and the outputs. And so we've been able to actually get the agents to go off and create a model based on the discussion in the paper. And I mean, we found this extremely powerful. And this is a lot of Dr. Sarami's work. I've got a very simple system dynamics model that came out here. I can run it. I can move it back and forth. Key thing is I can play with the parameters, right? I can say, well, this is what the paper had in it. What if I tweak these one or two other parameters? I can even go in and add parameters. And so the idea is now you'd have these results go into this section. This would be the system dynamics model. Maybe I have an agent-based model. Then I could go off and I could run that agent-based model also and put these inputs in here. But the key thing is now I can start playing with them. This becomes a base model that I can utilize. It's all implemented in Python, so it uses SymPy, which is a library to build things up. I don't need to have these very expensive modeling tools available to me. So that kind of just shows a quick preview of what we built. Some example policy questions, just sitting down and thinking through it, and knowing Lynn is an industrial-based policy is her key thing that she thinks about. It's like, what could I do in industrial-based policy? Well, I could look at new incentives and penalties, and then utilize existing data to think about how and model how that would change things. I could start playing with innovations in the marketplace, sustainment cost reduction, potentially different ways of trying to reduce that. The Buy America First versus NATO partnering approach, supply chain resilience, for example, raw materials. That's all over the news lately. And then just recently found this one where in FY25, and there were changes in the FY26 NDA for qualification of industrial capabilities. Potentially, we can speed things up by using just normal, non-traditional DoD players and whatever they do to certify their capability in the marketplace. We can go after reform policy changes, secondary, tertiary effects. Look at DoD benefits from American infrastructure investments. And then acquisition approach decisions, for example, upgrade old or buy new trade-offs, which always comes up, especially with major weapon systems. And so the key things now to actually make this operational is we need to go from that very simple model you saw created in the demo to being able to do more complex models. That's going to be probably our next big thing we put in. And then be able to transition this into a CUI environment, controlled unclassified data, to where we can access data from Advana, the DoD's, I would say, data warehouse, and then model directly from data and validated pre-existing models. And then the next step after that was in try and take the DoD policy documents we have and map those into existing models and data, and then identify whatever gaps we have in both in terms of models and data. And that pretty much covers it, Arun.